Parents, I believe, care more about their children than the medical profession.
The FDA is telling someone battling a disease like cancer that they cannot have a potential life-saving treatment.
You don't take somebody off of a treatment that's working and doing well. I think that's just injustice.
At the heart of it all, the freedom to choose whatever treatment a patient wanted.
The FDA has transformed itself from regulator to persecutor in this case.
Every parent knows what it's like to have a child with the flu. It usually goes away after a few days, but not for 2-year-old Dustin Kunnari. His severe headaches and other flu-like symptoms kept coming back, leaving his parents and doctors baffled. When Dustin got even worse, an MRI revealed a cancerous, golf ball-sized brain tumor. His doctors prescribed an aggressive radiation treatment that carried the risk of devastating effects. Dustin's parents, however, refused to accept such a possibility.
At one point, one of the oncologists told my wife, she said, "We'll get that tumor, but you have to expect that Dustin may be in a wheelchair."
His time left on Earth would have been short, but it would not have been the Dustin that we knew.
Stunted growth, sterility, low IQ. This is our cure. This is what we're going to give you. Your son back in a wheelchair with all these issues that he's got to deal with till he dies. In my mind, I knew I'm not going with this treatment.
There was a nurse, and she told me, "Don't give up." She said, "There is a world of treatments out there. Do your research." As long as Dustin lived, he would have a quality of life. That's all we were basically looking for.
When he came to us, he was quote unquote incurable.
Dustin was born in May of 1991. He was your typical healthy, happy little boy who loved being outdoors.
I always felt he was a little more laid back.
He seemed to get along easily with people.
He was a why child. Why this, Mom? Why that? He was a very happy little boy. Dustin was a very healthy child. He was never sick. The only thing I brought him to the doctor for was your regular checkups.
When Dustin was 2.5 years old, his family noticed some changes in his overall health and behavior.
On Christmas of 1993, Dustin became very ill with the flu. The other kids had the flu, but it wasn't the same.
Dusty was very energetic, and the first indication that caught my attention was one day he was playing, and all of a sudden he just started to scream.
I noticed also that loud noises would really bother him.
He could be in a room that was full of children playing, and he would lay down and go to sleep, almost like his body was shutting down.
He'd want to be with the other kids playing with them, but just couldn't keep up.
Dustin became more ill.
A lot of vomiting, and he was just a sickly little boy for a couple months there.
But then he was having trouble walking.
As he's walking, we noticed that he's kind of stumbling, I believe, to his right side, and he actually reached out to support himself on the wall.
In my heart, I knew that something was extremely wrong.
All the medications Jack and Marianne tried were having no effect on Dustin's increasingly severe symptoms and general listlessness. The Kunnaris urged their doctor to give Dustin a more thorough examination.
They did blood tests, and they checked him, and even drew blood and did extensive testing. They said, well, maybe he has like a little infection. So they sent us home with antibiotics. They said if he doesn't get better in a short time, bring him back. Well, every other day, he started to have flu symptoms, and he did have severe headaches. I mean, severe headaches, where Tylenol, ibuprofen, nothing would stop the headache.
We knew that there's more going on than a stomach flu or something. I had to go to the doctor myself. Dustin didn't have an appointment, but I brought him to the doctor with me. The doctor looked me over quick and said, "Jack, you're okay," but he said, "We've got to get an MRI scan for Dustin. There's something we need to check here."
Jack called me and said the doctor thought there was something severely wrong with Dustin.
As I sat there by Dustin's scan in the room with him, it was real apparent to me that my son had a brain tumor.
Two-year-old Dustin Kunnari had been experiencing chronic flu-like symptoms. An MRI revealed that something was indeed seriously wrong with young Dustin. He had a brain tumor.
He took the scan and he said, "Jack, this is the tumor." He showed me where it was, showed me the damage it was doing, and said, "We've got to deal with this. We've got to get at this tumor right away."
It was located between his cerebellum and his brainstem in the back of his head. They ordered a surgery.
The neurosurgeon felt pretty confident in what he was doing.
And he just reassured us that he would get out as much of the tumor as he could.
Risks in operation involved potential loss of motor skills. It's an area of the brain, I believe, that it can affect your breathing. Those are the things you don't know until after surgery is complete.
I was relieved to know what was wrong, yet to have to put my 2.5-year-old through a surgery that we didn't know the results. That was very, very hard.
Following surgery, Dustin's neurosurgeon confirmed he had been able to remove most of the tumor.
He told us that he was able to remove about 75% of the tumor. There was some that was left along the cerebellum and along the brainstem.
And he said, "I do have some troubling news for you." The name of the tumor was a medulloblastoma, and it is a very aggressive stage 5 brain tumor. Ultimately, Dustin didn't have very long to live.
We were told by an oncologist that he may have as little as 6 months.
Because of the aggressive nature of Dustin's cancer, his doctors recommended that immediate action be taken to halt its growth.
Typical treatment for brain tumors is radiation.
The next day, the radiation therapist came in and gave us pretty much a death sentence for Dustin.
Being Dustin was under the age of 3, he told us flat out, if we radiate Dustin's brain, he will be a vegetable. No question about it. So we eliminated that option. We're not going to do radiation.
The Kunnaris had another choice: chemotherapy.
We're trying to be open-minded. I had my concerns already about chemotherapy, but we had to check it out. We had to see what the options were. We were consulted by our family doctor, and he says, there's an experimental treatment that they're doing at the University of Minnesota involving different regimens of chemotherapy drugs.
The computer would pick the drugs that Dustin would be on. And the drugs were horrible. I talked to my brother, the doctor. I called him up and told him what the drugs were, and he said, "They use that on children?" We started researching on our own and finding out that chemotherapy really didn't work very well on brain tumors.
Side effects were devastating. We've got the consent form that we never signed that lists the effects of the chemo drugs.
In the form that they gave us, it did say that these drugs could cause possible death.
We told them we needed some time to think.
When they weren't able to persuade Jack, he said, "If the Lord had given me a handicapped child, I would have accepted him, but I am not going to make him to be handicapped."
When we heard the percentages and the side effects and the whole scene, I thought, I can't do that to my son. So we looked into other alternative treatments.
The Kunnaris embarked on a quest in defiance of conventional medical wisdom.
Even if it wasn't that long, quality of life was what we were looking for. Jack's sister gave us information that she heard when she was looking for an alternative for her rheumatoid arthritis. And that's where we found Dr. Brzezinski. We contacted the Brzezinski clinic and asked them if Dustin could go on the treatment, being that he was under the age of 3. Dr. Brzezinski did need Dustin's records.
We went in just to get our medical records, and there was a couple social workers, head of the oncology department, at least 6 different people said, "We want to talk to you." I said, "I don't want to talk. I just want my records. I want to go." They brought us in a room, closed the door, and explained to us that doctors take precedence over parents. You have an obligation, or we'll take, and we will treat Dustin with the chemotherapy against our wish.